in the health sector. Why would nurses be on strike?
Because there's a CBA that has not been honored.
2017.
If the right to attainable standard of health is a constitutional right in the Constitution, and medics are not unreasonable people, and Dennis and viewers, why can the county governments be able to agree with the doctors' union, with the clinical officers' union, with the nurses' union? What is the problem? And nurses in this country are not paid a lot of money.
No.
Clinical officers are not paid a lot of money. Even when you look at how much we pay doctors in this country, we pay members of the county assembly more money than doctors. Comparatively, when you look at what a member of the county assembly does in this country and what a doctor does in this country, one touches at the heart of life. The other one is paid to go and vote in the assembly and fighting to get contracts. Most of our MCAs are contractors now. They don't do any oversight. They don't do any representation. In fact, some of our MCAs, and we've seen this in Senate, some of our MCAs cannot read. They cannot read. Some of them cannot write. Of course, this is not a general condemnation. I know we have very learned MCAs, but we also have a fair share of members of County Assembly, Dennis, who cannot read. They can't write their names. I have seen a member of County Assembly who, instead of writing MCA, writes MAC. And we've all seen this in Senate in some of these impeachment proceedings. So why do you pay a member of the county assembly, even if you are the Salaries and Remuneration Commission, why would you want to pay an MCA more money than a doctor?
When you look at the failure then that is associated, especially in the healthcare system, I want to go back to the overall bird's eye of the health sector, where the president sits. Healthcare of the country is a constitutional right. The budget that he will sign to become an act of law has a health component in it. That means in one way or the other, the buck stops with him, because monies would go to the ministry, then would be disbursed all the way to all these hospitals that we talk about. Now, when you look at the management of healthcare from that national level, how has it been? And if failures do exist there, how do we expect that at the level 1, level 2 will get it right?
Thank you, Dennis and viewers. I could not agree more with you. I started by saying we only needed to have a very lean staff in Nairobi so that we don't pay a lot of salaries for people who are busy doing nothing, people who are doing paperwork. Health sector is very practical. There's a research component on policy, which, as I have said, should be very lean. It looks like the government is more interested in the funds associated with the health sector as opposed to the health itself of the citizenry. And as I have said, when you look at NHIF, today as we speak, National Hospital Insurance Fund, which is now defunct, also hospitals in this country about 33 billion shillings. 33 billion shillings for services rendered, for people who are treated. And nobody is talking about it. We're very silent about it. Social Health Authority has accumulated about 43 billion shillings. This is money that should go into salaries in private hospitals, in mission hospitals, and in public hospitals. 43 billion shillings. Why should SHA, which is receiving funds from Kenyans, accumulate 43 billion shillings within such a short period of time? Where will the hospitals that we're talking about get money to pay salaries from? Where will they get money to pay, to buy drugs and other supplies